Here is your stem.
Okay. Okay, I'm ready.
All right, so if you've read and understood considering it history taking station, please begin.
Okay. Hello, good afternoon.
Hello,
My name is Dr. Dua. I'm one of the surgical doctor. Uh, how can I address your name and age, please?
my name is Lisa and I'm 68 years of age.
Okay. Nice to meet you. Today, Miss Lizana, I believe that you are here today, for the assessment of your hip, for your surgery. Am I right?
Yes, yes, doctor.
Okay. I'm going to ask you, some questions. Okay. Could you tell me, how this pain affect your life in general?
Yes, doctor. Actually, I was advised surgery 4 years ago, but I don't
Mm-hmm.
want to do that surgery, so I refused at that time. But now
Mm-hmm.
this pain is very, very severe and I can't even walk. So now I want
Mm-hmm.
the surgery to be done now.
Uh-huh, uh-huh. Okay. I'm so sorry for that. I know it must be very painful for you that. Okay.
Yes,
Do
doctor.
you have, yes, okay. Do you have any walking difficulty?
Yeah, I have walking difficulty. I use sticks to walk, and
Mm-hmm.
most of the time I do rest and take some painkillers to stop the pain. Yeah, but now
Okay.
it's not working for me. I want to be surgery to be done as early as
Uh,
possible.
okay. We'll do our best to help you, Mr. Zania. Okay, Mr. Zania, could you tell me that do you do any regular exercise?
No, I don't do any exercise.
Okay. Okay, Mr. Zania, do you have any difficulty with this upstairs?
Yes, I have difficulty. I cannot I get shortness of breath when I take one
Mm-hmm.
like 5, 6 steps. I cannot walk.
Okay, I'm so sorry for that. Okay, Mrs. Daniel, could you tell me that do you need any assistance at your home for your daily activity?
Yeah, I do need assistance. Yeah, there is
Mm,
social worker is there that help me for for that purpose.
okay, and for how long you are walking before stopping?
I can only walk 10 or 12 steps. After that, it's very painful and I cannot walk.
Okay, okay, Mrs. Do you have any medical problem?
Yeah, I'm having diabetes and hypertension.
Mm-hmm.
I'm taking medicines for that.
Okay, okay, could you tell me more about your diabetes? Since when you have been diagnosed with diabetes?
It's been around 12 years.
Mm-hmm. Okay, are you taking any medication for the diabetes?
There is a medicine like glucophage something, 1000 milligram or something I took.
Okay. Uh-huh. And about your hypertension, since when? And are you taking any medication for it?
Sorry, I don't understand what you're asking.
High blood
About your
pressure.
high blood pressure, are you taking
Yeah,
any
I have this
medication for
pressure
it?
from yes. Yes, I have this pressure from last 10 years and I'm taking atenolol for that.
Uh-huh. Okay. Okay. Do you have asthma?
Yeah, do have asthma and I
Mm-hmm.
use steroid inhalers for that like 2 times a day.
Mm-hmm. Okay. And do you have any chest pain? Do you have any shortness of breath?
Yeah, I have this episode like 2 times before. I admitted in the cardiology center or something because I have some severe pain during that time. So sometime I got this pain again and again. Yeah, I do have this.
Oh, I'm so sorry for that, Mister. I'm so sorry for that. Okay. And how it was treated? This is episode of myocardial infarction.
They give me some medicines like some blood thinners so that now I'm fine. I don't have any kind of pain right
Mm-hmm.
now.
Okay. Okay. Do you have any difficulty on breathing when you are lying flat, or are you gasping at the night? Do you wake up at the night gasping for the air?
Doctor, I'm fine with that.
Okay. Well, okay. Okay. Do you have any other medical problem rather than this?
No, doctor, I'm fine.
Okay. Do you have any complication or problem associated with the sedation?
No, doctor.
Okay. Well done. Okay. Do you have any have you been admitted to the any at surgery to do any surgical operation before this?
No,
Okay. Okay. Could you tell me that do you have any allergy to any medication?
medication allergy? No, I don't have any medication allergy, doctor.
Okay. Okay. Are you taking any medication regularly rather than medication you are told me about?
No, only these medications I took. I already told you that I'm taking these medicines, no other medicines.
Okay. Okay. Are you taking any blood thinner medication?
Yeah, I told you before I take blood thinner.
Okay. And why you are taking this medication? And could you tell me the dose?
It's I think clopidogrel 150 milligram, and the doctor for my angina pain give me this medicine.
Okay. Do you have any similar condition like this in the family?
Like what condition?
Like this pain?
Can you please
No,
summarize
doctor.
your history?
Okay. I would like to present Mr. Razania who presented with who presented with pain, hip pain, and he had he had diabetes, for which and he had hypertension, and he had asthma, and uh, yeah,
Hmm? And what?
and asthma, diabetes, and hypertension, and
And here is the cursor, recurrent angina.
yes, and he had a
Yes.
history of angina,
And
and
taking
and
anticoagulants.
taking anticoagulant, clopidogrel,
Yes.
and
But yes, and has been placed on total hip replacement.
and has been reversed for the total hip replacement.
So what, yes, what is your assessment about the patient? Should the
Yeah,
patient's procedure go ahead
no, this
as
is patient.
planned?
No, not proceed. Because this is patient has comorbidities. Like
And
and patient cannot be able to give consent.
what would be your plan of action?
My
If
plan of
you'll
action.
cancel the, yes, if you would cancel the surgery, what would you do for the patient then?
Okay, first of all, I'm going to do full examination, full history and full examination for this patient. I'm going to focus on the risk for his cardiac and his pulmonary and his complications, and I'm going to do a preoperative investigation for him. And
What preoperative investigations?
investigation,
Which?
I will do.
Yes.
Yes, okay. Okay, I will start by the blood investigation. I'm going to do a blood investigation, full blood count. I will do urea electrolyte, and I will do and then I will do
Just X-ray,
ECG,
ECG.
echo, yes, ECG, X-ray, ECG, just X-ray, and I'm going to do mhm.
Thank you.
Okay, thank you. It is very difficult for me